And then I'm sorry, tell me again, make sure y'all can still see the video.
Yes.
Okay, very good. Thank you. Okay, so all these are signs of infection, the redness, the swelling, and he said it hurt really bad. So, and he doesn't, but the good news is he doesn't show any signs of sepsemia or blood poisoning or that red streaking, which I'll show you examples of. So we're going to go ahead and start here. And the doc, and they say the doctor's talking about how he went somewhere else, and the doctor gave him an antibiotic, and so now he's here. That was about a week ago. And that's called the doctor's palpating. And then what he just did there is he felt it and he said, see how it's red right here? He goes, that's called secondary infection. And then he felt up here and looked. He said, oh, that's very good that there's no streaking. So that means that it hasn't spread. He said that he might still give him a shot of antibiotics after all this, just to be safe. So the first thing he's going to do is clean it because we have to have an aseptic site where that he's working on, right? Because if the site's not clean and he was to start working on this, all he could do is he could further the infection. And I'm gonna pause it for really quick. What he's using here is an iodine solution. And we like iodine when we do any type of surgical procedures because it stains and it marks. So it allows us to make sure that we are completely getting the area clean. And if you notice the way that he does it, he starts in the center and does circles all the way out. That is the correct way to clean any area. If you're drawing blood, if you're giving an injection, if you're cleaning for an incision, anything like that, that's proper, okay? And what he has here, these are called chucks, and y'all be using these in lab. I like them for phlebotomy. It makes it easier. Now, what he's going to do now is he's taking a lidocaine, which lidocaine is going to numb it, okay? And what I want you to pay really a close attention to is when lidocaine is injected, we know that it works. See what the color that it's changing? This is called blanching. Blanching is what we want. We want to see that this anesthetic is spreading and going all the way around. He's given one injection. He'll probably, I think he gives a few others. And this is how we normally do anesthetics to make sure the entire area is numb. And that sign right here is very good, that blanching. And he's doing it nice and slow so that it's not painful, it's not discomforting. That's a good doctor will. And a good doctor will also make sure that he does it in multiple sites to make sure that the whole entire area, just like when you go to the dentist, when you have a tooth worked on or something, they'll take the tiny little needles and they'll have to inject that, and they don't just right at that tooth. They go in multiple areas to make sure the whole area is numb, because we don't want him to experience any more discomfort than what he's having right now. Okay, so we see how that it's blanched out and it looks like it's ready. So he does something smart. He measured this because he knows that he's going to need a bowl because of the amount of drainage. Okay, so he's modified this so that when it's ready, if this is just like a little tray that sterile instruments come in, that's what he's using because it's sterile. And the bleeding's normal just from the punctures of the lidocaine. So it's no big deal. And that's just that's called interstitial fluid that's coming out. Now he's going to take a scalpel, and then unfortunately, because he's paid, he's big time, he has a commercial in the middle of it. So yeah, we're forced to look at his paid advertisement talking about the Manta sleep mask. I don't know. That's the first time I've seen this, so he must be making a lot of money off of it. All right, so now he's coming back. So he's taking his scalpel and he's going to make a small incision. It's usually not necessary to big. He's checking first to make sure it's numb. And the guy says, yeah, it's numb. So now he's going to start. And immediately you can see the pressure and all of that. This is pus. This is bloody pus. And this is how I said, please don't eat before, because I don't know how many of y'all are squeamish. So he's going to make it just a little bit more because he realizes that, yeah, there's quite a bit of pus in there. And so he's going to allow it to naturally drain as much as he can. And that's what we usually do. And the guy here, he's saying, oh my God, it already feels better, because he immediately feels relief because all of that pus is now coming out. And like I said, this is not for the lighthearted. Now, it's naturally, there was so much pressure behind it. Now the doctor's what we call milking. And whenever we have an abscess, a lot of times we have a little cyst that form all around the abscess. So that has to be drained and dealt with as well, because little pockets of pus, a lot of times, like you see one still here, well, when he moves his arm, here, and then here. Now he's going to go in, he's going to go ahead and stimulate it and check for pockets. And now he's getting all those extra pockets of pus that are around it. This is very, very common for people who get staph infections and it's not treated properly. The other one that we'll talk about is called a pyodontal cyst, and it's right above the tailbone. And it's not uncommon too, and I'll show you. Now what he's going to do is called irrigation. He's taking normal saline and some sterile gauze, and he's going to go in that wound and he's going to flush it. All right? Because he needs to get as much more out of there as possible. So he's irrigating. That's called irrigating or flushing. And he's really injecting that in there because he wants to make sure that he's getting all, and now he's working those additional sides. All right, and you can already see how much the swelling's gone down. And he's talking about how much better it feels. That's what he's saying. He's not in pain because the lidocaine has numbed everything. And he's talking about it, what relief it is. And there's still that pocket right there. And that's what the doctor's trying to work on. And he cleans it and he gets him, and he finishes up and everything. And now there's a couple of things that we have to take into consideration here, because it's now, once he gets everything cleaned out, he's flushing or irrigating more. And he's hoping, to get rest of the pus out. And I'm coming here. I'm going to squeeze up a little bit. Now, what he's going to start doing now is called packing. Now, let me explain. Do you see how he's got the tweezers? All right. These are actually they're sterilized, and he's taking sterile gauze and he's going to pack it into that wound. And you're like, what and why? Because when you have a hole that's left, and this is very important for proper cleaning of any type of surgical incision, drainages, and stuff like that. You have, a lot of times, if it's deep enough, if you do not pack it, the first thing that the body does is it automatically makes a covering over the top. So where is it actually healed on the inside? No. So what packing does is it prevents the top from being covered, and it forces the skin and the tissue to start growing from here. And the next time he goes in to have that packing removed, they'll put a little bit less packing. And then the tissue will continue to grow, and then it'll need a little bit less packing. And then the tissue grows from the inside until it finally doesn't need to be packed at all. So this is a way to reassure deep wounds are actually healed properly from the inside out, because our body's initial response is cover that hole. And we don't, at this time, we don't want that, because we don't want a gaping hole underneath that wound. You see what I'm saying? So he's packing it. And you see it takes quite a bit. So that was a big hole. I'll show you a periodontal cyst, and I swear to God, the doctor used a roll this big to pack the hole. I was just like, I was blown. It looked like he could probably stick his fist in it. It was massive. And so he's packing, it's getting tight in there now. Now that's called a dry pack. All right. Some wounds require a wet packing where they'll actually soak the gauze in a sterile saline. And so that when it does come out, it doesn't pull, it doesn't cause. And that was the pus that was all inside of that infection there. And you see how he has everything here. Now he's a doctor, so he can put his sharps. Oh, it doesn't look like he has I guess that's a retractable. I don't see any. So it looks like he did a good job with that. Sometimes doctors will, because they're the only ones that are allowed to get away with sticking their sharps down. But we will always, always take our sharps and go. Now he's taking a little bit of it because he's going to culture it. He's going to make sure. He's going to send that off to the lab. And then I think he said something about giving him an antibiotic. Now he's going to wrap up that wound. And the guy's telling him, wow, it feels so much better. All right. Okay. Now let's talk about questions with that. Who's got questions?
I'm just stuck on the video, like I'm just still stuck a little bit, like, oh my goodness.
Okay. And I'll let you know, it's not uncommon to have. I worked at a military, like a place where 15 through 18-year-olds that got in trouble with the law, and it was either go to jail or go to like a boot camp school. And I was the nurse there, and we saw lots and lots of staph infections like that. And I actually dealt with one right above the tailbone, and that's called the periodontal type cyst. And he had the pockets and everything. They didn't want me taking him to the doctor because they were in trouble, you know. And so I did my best with this, and I drained it, I cleaned it, and everything like that. We got lucky with him, and his body responded really well and healed up really quick. But then we had another student who had one on his foot from they made him run so much he got blisters. Well, one of the blisters became infected, and it caused like a big abscess. And I had to take to had to argue with the drill sergeants and tell them, nope, man, he's going to the emergency room. Shut up. So, because he needed antibiotics. There's only so much that I was able to do. So and the reason I showed that is because we had so much information right there. We got to learn about the incision, the drainage. We got to see that inflammation response in action. So you got to see the redness. You got to see the swelling. And if you had heard the video, I'm going to post that video, you can, if you want, and then you can listen to the commentary and him talking about how painful it was. And then, and that it was hot to the touch. Those are signs of and symptoms of the inflammatory response, infection. All right. And the reason that's important to us is because we need to identify that. We need to be able to jump out and say, okay, yeah, that don't look so hot. And then if, like I said, we see she's streaking, and I'm going to pull this up and I'm going to hope y'all can see with me here. Can y'all see my screen again?
Yes.
Oh, beautiful, beautiful. Okay. This is what I was talking about, that streaking. So this is what you'd want to worry. Here's on this baby. He's got, looks like a bite or something, and that's his body telling him, this ain't working. This is another great one. And so it's showing, where it started and how it's moved. Now let me explain to you what this person has done. This is a better image. This is the next thing I was going to talk to y'all about. So she got some kind of bite, wound, something. I'm not sure if this is it or what it was, but her leg is now in what we call an inflammatory response. Now, what she's done and what the doctors that she went in and they marked it. And here's Scalp's rule for, let me see if I can find it properly. Well, okay, this will work too. Okay, so this image here, so here's the wound, and what the person's done is initially drawn a circle. Okay, so back to this lady here. So what she should have done is, or if you're ever in concern, that this would be a perfect example. So here we have we'd mark it with a pin of the whole entire red area. This, and we notate the time, right? If that spreads past that initial area we marked, we're going to mark that again. We're going to draw another outline, right? Okay, now here's where it comes into play. If it spreads past that second drawing of the marking, it's time to go to the hospital. That's a good way to know, hey, should I go to the hospital with this? And that's what we do with all my kids. Anytime like that, anytime they were bit, any type of infection, because that let me know. And I'm not liking these now. Hold on one second. Marking size, no. Yeah. So we're gonna go back here. So all of these examples of this streaking, this is blood poisoning and or sepsemia. So this is really bad. This one's, her body's really letting her know. And y'all can see this. And what that means is it's traveling. Here's a good person. Somebody marked it. And well, let me just explain to you here. The second that it moved past here, they should have went in. They just kept marking the streak. Well, honey, once it starts streaking, it's time to go to the hospital. So they were trying, all right? So, but that's what is really important. This is what I want y'all to understand. Sepsemia, blood poisoning, okay? This is our body's way of telling us, I can't fight this alone. Help. Okay? Does that make sense? So we're going to go ahead now and we're going to get into, I'm a ding dong. Hold on one second. Sorry, guys. Any questions about that so far before we move on? No? Y'all are just rocking and rolling, huh? Okay, that's why I told you don't eat no breakfast.
I actually like watching those videos.
You know what? I'm a sick type of person too. It doesn't bother me one bit. And Dr. Pimple Popper, I love her.
Exactly, yes.
Yeah. we're the twisted few.
Her too. I'm like, that's why I was like, I get to see this actually up close. I had, to be honest with you, I had an abscess before. It was a while.
Yes.
So that was kind of like interesting to watch that.
Yeah. And what I loved about it is you got to see, because when we go talking about surgical procedures, I always try to explain blanching, and you never really get to see a good example of it, but that's what we're looking for. All right, I'm going to open and share, and y'all tell me, see my PowerPoint?
Yes.
All right, so we're going to, I know we're past our 30, but that first 30 was lab. So that means today, all of y'all who are my online labbers, you're good to go. Yes, I post, how many of y'all watched that video about the lymphatic system? Crash course?
I did.
Okay, great. That video really, it helped to explain that just like the circulatory system, the lymphatic system is its own little network and everything. Now, the next few slides, the next few slides, I'm going to go through and give a brief overview, but the videos that I have posted in Teams really explain everything to such perfection that I don't need to focus on this that much. But one of the two things that I do want you to write down, if you didn't catch it on the video, you may have not known the importance of it, is I want you to write down that we have two types of really important cells in our immune system, okay? And I want you to know that all cells for our immune system originate in our bone. How many of y'all knew that? That's like, most people don't know that. We just think bones are structure and calcium, right? Our bones are actually our life source. That's why when you hear about people who get really sick, they have bone marrow transplants, because bone marrow is where all cells are made and produced for, like, our red blood cell, our white blood cells, and our immune system, all of that. Okay? And there's a process, so make sure you understand. Cell starts in the bone marrow. And we call these cells, when they first come out of the bone marrow, they're all called B cells, B for bone. Now, as a child and a young adult, our body is building its immune system. And we're going to talk about the thymus, because all cells for dealing with the immune system start off as B cells, but they're traveled to the thymus. And then from there, it's sort of like boot camp basic training, and they're given specific jobs. And some of them are even given new titles like T cells, killer T cells, or, so on and so on. So we're gonna kind of briefly explain that. But like I said, there's going to be a video I'm going to post today, and I promise you, if you watch it, it's really good, and it really talks about how the origin of how our body starts cells and how it continues them through the process, and basically maturing them into their final job and their position in the body. Now, immunity, and this is a definition you should be familiar with, but immunity basically means that you have the state or the capability of being immune. There are people walking around who are immune to COVID. And can they still have COVID? Absolutely. And those are our spreaders, because they're totally symptomless. They have no signs, no symptoms. And so that's what we have a real issue with, and why one of our, this pandemic's out of control, is because we have people who are immune. All right. Now, if your children have had their vaccinations, they have a 99.9% chance that they are immune to measles, mumps, rubella, varicella, which is chickenpox, right? And pertussis, all of these potentially life-threatening childhood type diseases. So we can get immunity by something different ways, okay? Now, I kind of went, there's a video that kind of went through this a little. I don't want you to focus and worry too much about trying to memorize this or anything like that. But I just want to cover a couple of really quick things, okay? Passive immunity and active immunity, okay? Active immunity can happen either naturally or artificially. Bless you.
Thank you.
Natural immunity is when, just like that sneeze, you picked up something, or maybe it's an allergy or something like that, but basically you picked up a cold. Your body memorizes that specific strain of that cold virus, and now you're immune to it. And you're like, well, Miss Scalp, why do I keep getting colds? I got bad news for y'all. There's like a million different strains of the cold virus. So, but once you get one strain of a cold virus, you won't usually get that strain again. Okay. So that's the same thing as back in the old days when children, they got chicken pox. They naturally occurred it, in classrooms or wherever, and their body wasn't able to overcome it, and then they had immunity to it. Now, artificial active immunity is when the pathogen, and that's that one video I showed y'all that I hoped y'all watch about vaccines, how the pathogen is introduced into the body. And there's multiple ways, sometimes by a strand of its DNA, sometimes by a beaten up version of it that's real weak, and sometimes by a dead version of it. But it depends on the however it goes. But what we need a tiny microscopic amount of that pathogen, say measles. And so we give our children the vaccine. And so instead of it being like a full-blown measles attack, it's like one little measles cell. And our body sees it and goes, hey, what's this? And it automatically makes an immunity to it. And so now we have artificial immunity. Okay? Y'all with me so far?
Yes.
Passive immunity, though. Passive immunity is kind of cool because it's just something we acquire, right? And one of the best ways that we get passive immunity naturally is when a mother passes her immunity to her baby, and breastfeeding. We have passed so much of our immunity and continue to pass that while we breastfeed. All right. So this is a natural way that it enters. Now, artificial passive. Okay. This is a continuation of this. We had a tetanus shot, say, when we were 10, right? So this artificial passive is we don't need another full tetanus. We just need boosters, and that's every 11 years for tetanus, right? So that would be a passive artificial. It's just a little booster, just to wake up the immune system and remind it, remember, we don't like tetanus, okay? So that's a brief kind of rundown of that. All right, so the next thing we're gonna move into is something called universal precautions. And when we think of universal, that we think of the whole world, right? And that's exactly what it is. So that means, how does the UK treat their coronavirus patients? How does Australia? How does Taiwan? How does America? Well, we have a universal way that when we're dealing with these patients as a medical professional, we're going to have gloves on. We're going to have a gown on. We're going to have a face shield and a mask, because we know that this pathogen, this virus, is spread by airborne droplets and that can stay in the air for some time. So back in 1985, the CDC, which stands for the Center for Disease Control, which somebody decided that we didn't need to be part of, and we're not communicating with them right now, which was probably one of the biggest mistakes that's ever happened in the United States, but I won't get political. But the CDC is an amazing force. They work with another world force called the World Health Organization that somebody also took us out of. So so now we're just kind of like little blind rats in a box smacking our head up against things and with no direction. But the CDC and the WHO they work together. And so their job is to say, when something like this happens, hey, here's what you need to do. Here's what you need to do. This is what, and they establish these guidelines depending on each thing we're talking about, right? So when we're talking about a disease that can be passed through blood and fluid, and so they'll tell you, okay, you need, gowns, you need face shields, you need eye protection, because you never know when something's you saw that wound. Did it gush? Yeah. And could that have gotten in his eye? Absolutely. Is that something you want in your eye? I didn't think so. So they develop these, and these are called universal precautions, standard precautions, and these are developed and maintained by the CDC. Now, this is, sorry, the picture's a little grainy. These are things you as an MA are going to be doing every day. Washing your hands. Washing your hands is going to be one of the utmost important things you can do to stay safe, period. And then nextly is wearing gloves, wearing a mask and eyewear, putting a gown on, disposing of biohazard materials in the right area, and then getting rid of articles, and then sanitizing and cleaning. And these are things that you'll do every single day. Last night I got off the phone, and I'm gonna wrap this up here, but I got off the phone with one of my girls. Her name's Aisha, and she was one of my sweeties from Houston, and she was just telling me, Miss Scalf, we're overwhelmed, and she was like, I thank you for forcing this in our heads, because I'm an MA and they're so desperate for help. They've got me in a COVID unit because I can draw blood, because I do understand the universal precautions, because over in Houston, the media is not telling you what it's like, but like they had in New York with the refrigerated trucks and stuff, their bodies are piling up. And she said, Miss Scalf, she goes, y'all not seeing the picture. She said, but she goes, I'm hanging in there. I'm making sure I'm safe. She said, and she told me something it made me feel good. She said, Miss Scalf, before I go home, because she lives with, she's young. She lives with her mom and her dad still. And she said, I take my shoes off outside. And she goes, I go straight to the bathroom, take all my clothes off. I bag them. And she said, I shower. And she said, then I wash my hands again. And after, she starts her laundry, and she washes her clothes separately, because she said, this has been the life. She was showing me, she's got such a beautiful face, but she's got markings all over around her face because she's worn a mask. Her hands are all torn up from how much she's had to wash them and everything like that. So, but she just had COVID testing, and it's negative still. So she's keeping herself safe. She's doing the right thing. She's using that proper PPE and sanitation and caution and following those guidelines. And I can't stress to you how important they are. Just like right now, I walk outside and nobody has a mask on. And I'm not here to tell you, you have to or you should, but I'll give it to you this way. As my brother-in-law, the doctor, said, if every single person would just put a mask on, we'd have this done and over with. Still go on a few months because the flu season's coming. Brace yourself. Game of Thrones, winter's coming. It's fixing to get really bad. And but if everybody would just have put a mask on at the beginning, we wouldn't be where we were. So it's a real big thing. I'm going to end that for today. I've already ruined breakfast for you and giving you some interesting facts. I'm going to post that one video I'd really like you to watch about how cells get their jobs. Okay? And then have a good weekend. I know y'all are my good class. There's so many of y'all, and y'all all get your Survey Monkey turned in. I got another class that's only got 18 of them, and I swear to you, every day it's like me having to beg them and plead and do your Survey Monkey, turn your Survey Monkey in, and still I just don't get it. I don't understand. I said that's, and so yesterday I had to be mean, and everybody who had it didn't turn it in by 1, they didn't get attendance. So I'm hoping that was maybe a wake-up call. So y'all are great about that, and I really appreciate that. So keep up with your Survey Monkeys. Work on any work that you have, watch the videos, and uh, have a good weekend. All right. Make sure you,
Have a good
oh,
You too, weekend. Steph.
also make sure you hang up when we leave. Bye, guys.
Bye.
Bye.